In this episode of Ask Dr. Zach,
sometimes it's actually much worse. I have psoriasis. I have it in several places on my body. I have it on my knee. I have it in my ears. I have it on my scalp.
And later,
I have that. It affects me by the changes in the seasons. I'm depressed because I can't get outside and move. I do start to gain weight. I'm living life one step behind.
Then, on the doctor's orders,
don't waste your money on supplements. Usually they're a waste of money.
In the ER, I deal with trauma and life-threatening situations every day. I've seen it all. I know firsthand that accurate medical advice can save lives. I'm Dr. Zach, and I'm passionate about empowering people to take control of their own health. This is your chance to ask me health questions. No question too big, no question too small.
Today's discussion will be focused on the skin, the largest organ in the body. Problems with the skin can range from minor to severe and include issues such as acne, eczema, psoriasis, and even life-threatening skin cancer. Knowing how to protect your skin and when to get it checked out can save you a lot of discomfort and can potentially save your life. To learn more, let's take a look at this Blausen medical animation.
The skin is the largest organ in the body and the major component of the integumentary system. It has many functions, including protection and temperature regulation. The cutaneous membrane is composed of a superficial epithelium, or epidermis, and the underlying dense connective tissue, or dermis. Beneath the dermis is the subcutaneous tissue, or hypodermis. These layers are supported by dermal blood vessels.
And we'll be right back with a lot more about the skin.
up next,
Sometimes it's actually much worse. I have psoriasis. I have it on my knee. I have it in my ears. I have it on my scalp.
all this and more right after this short break.
Sometimes it's actually much worse than this. It seems to come and go. I have psoriasis. I have it in several places on my body. I have it on my knee. I have it in my ears. I have it on my scalp. And so I just want to know the best way to care for it. For the scalp, I use tar shampoo, and that seems to work well for the scalp, but it's still bad on my ears and other patches of the body. Here in the privacy of my own home, I can wear shorts and do gardening and enjoy myself. Don't have to worry about anybody seeing me. Growing up, I had dandruff all the time, the flaking of the skin on the scalp. So whenever you got dressed up or you'd go on a date or whatever, you'd be very self-conscious about having the flakes on your shoulders. It's all like inside here. The skin is sort of scaly and rough. I've had it on my elbows when I was younger, and that seemed to get better, but now it's on my knees. I've had this for as long as I can remember. I've got 3 children and 5 grandchildren, and luckily none of them so far have psoriasis. That's my wife, and that's my granddaughter. My granddaughter, who's 3, she, says, I've got boo-boos, and she wants to put Band-Aids on it and look after it. I'm used to it. I've had it for so long. I'm just used to it. I'm hoping that Dr. Zach can recommend to me some ways of looking after this psoriasis.
Now it's time to ask Dr. Zach.
And welcome, Spencer.
Hi.
Thank you very much for joining us.
Thank you.
And thank you for sharing your tale.
Okay.
I mean, it's, one of the things that you brought up when you spoke with the people earlier is the fact that, it's affected your life. And that's something that happens with a lot of dermatologic issues. But even now you mentioned that, you're still in the privacy of your own backyard. You're able to sort of uncover and stuff. So you're still in public, you're self-conscious about it, eh?
Yeah.
And I can imagine when you're a child or a high school, I mean, that must be many times worse.
Oh, yeah. Like, I used to have ads when I was a kid, the heartbreak of psoriasis. It's true.
Maybe we did have a picture, not of you, but just so people know what psoriasis looks
Right.
like. So that's sort of typical. That's sort of the typical psoriasis. Basically, you get these plaques, and basically you end up with extra layers of skin, and there are these red plaques, and often there's a little silver sheen on the top, or a layer of old skin cells that makes it look silver.
Right.
And it can be in a number of different places. It can be actually the whole body. There's some places like knees and elbows that are sort of classic, but it can be anywhere.
Right.
I know you have it on your skin, you mentioned.
Right.
Do you have any other manifestations? I mean, because some people get it in their nails, some people have...
I have very brittle nails. My
Brittle nails.
nails break like for no reason, so I always keep nail clippers around.
Right.
Yeah.
And how about anything in your joints? Have you ever had any, like there's something called psoriatic arthritis you may have...
I don't know. I do get pain in my right knee, and for some reason, I don't know why, my right elbow here sometimes sort of locks up.
Certainly if it starts to bother you a lot, it might be worth looking into. It's still a minority, you know, it's still, I think, somewhere between 5 and 40% of people with psoriasis have the psoriatic arthritis. So it's still the minority, but you never know, it could be. And so I assume over the years you've tried different things in terms of treatment, eh?
Right. As I said, when I was younger, I used to go to a dermatologist, and I got steroid shots and creams, and that works very well for the psoriasis. But you worry about the long-term effects of the steroids.
Yeah. And for the steroid, was that a cream, or did you have to take a pill or an injection?
I've had both, the injections and the cream.
Yeah. And you bring up an important point. The steroids certainly systemically, so either by injection or, well, actually not. If it's injected just into a joint, it's just in that joint. But if you take it injected obviously into the vein or into a muscle, or if you take it by pill, then you have potentially side effects.
Right.
It's not, you know, if you take a steroid for a few days, it's not a huge deal. But people who take them for years, and some people do for certain medical issues, there are significant side effects. Right. So number one, I think the other big one is they sometimes use UV light therapy. And there are pros and cons for that too. Of course, you know, UV light, depending on the type, can increase your risk for cancer or just sunburns. They're usually careful about that.
Right.
But in some people, you know, who the topical stuff doesn't work, they'll move on to the UV treatment.
Right.
And by the way, there are other topical things. There's some vitamins. There's vitamins in the cream that can actually be helpful as well. And then sometimes, usually this is reserved, the systemic stuff, I'm talking about pills and immunosuppressants, so pretty strong medications. But if it's really out of control and it's in the joint, sometimes the doctors will prescribe those medications because there is an immune component to it, as you may know. Like a lot of diseases that we're seeing these days, that the immune system is involved. I think you know there is a genetic component, but so far no one in your family...
Well, my mother had psoriasis, and I've got psoriasis, but none of my kids or grandkids seem to have psoriasis.
So that's very good,
that's good, yeah.
I mean, it sounds like it still is potentially affecting your quality of life, eh?
Well, it still does. I mean, as I said, don't want to wear shorts. Things like that, and you know, like I was saying with my granddaughter, like she's only 3, but you know, she'll come around and say, you know, why do you have boo-boos and things like that.
It's a sweet picture you paint, but it's also poignant, you know. She's worried about you. You know, if it's bothersome to you, it might be worthwhile reconsulting with a dermatologist to see what's new, you know. Things have certainly evolved. Well, I want to thank you, Spencer, so much for coming and chatting with us.
Well, thank you so much.
Thank you.
Now, Dr. Zach's prognosis.
Spencer has psoriasis. Psoriasis is a serious illness of the skin, and the problem with it is a lot of people can see it, and it can be embarrassing, and it can really affect people's quality of life. Now, Spencer has used in the past creams, which have really helped him. Right now, he's learned to live with it, which is good for him. If it's bothering him, though, I would go back to using the creams because it's just a local treatment. It doesn't affect the rest of his body. Sometimes, however, you need something stronger. So some people need to use UV light, and other people need to use pills that are even stronger. But for now, Spencer has maintained a good quality of life, and he has a positive outlook, which are 2 of the most important things.
Now, let's ask Dr. Zach about seasonal affective disorder that's related to changes in seasons that begins and ends at about the same time every year.
Seasonal allergy, just one of the many problems that can be caused by the change of season. Issues with the change of season can range from minor to severe, a simple cold or flu, to seasonal affective disorder, which is a form of depression that affects individuals primarily throughout the fall and winter, sometimes to a crippling degree. Let's learn more about the brain and depression from the Blazen medical animation.
The brain is composed of millions of interconnecting nerve cells called neurons. In order for a person to think, move, or feel, these neurons must communicate with one another. They do so by sending and receiving chemical messengers called neurotransmitters. When a neurotransmitter is released from a neuron, it crosses a cleft or synapse and binds to a receptor on another neuron. Thus, the signal is passed on. Unlike the blues, sadness, or even grief, depression is a condition in which a person feels an overwhelming and debilitating unhappiness. People who are depressed may have trouble thinking clearly and be unable to perform normal functions. They may be uninterested in eating and be unable to sleep, or they may engage in these activities excessively. Persons with depression may even have thoughts of suicide. Although depression can be triggered by an emotional event in a person's life, a decrease in the levels of one of the neurotransmitters, serotonin, has been linked in the biology of depression. There are many forms of depression. Therefore, it is important for a person who may be depressed to see a doctor who can accurately diagnose the depression and prescribe appropriate therapy.
And we'll be right back with much more about seasonal affective disorder.
Still ahead,
I have SAD. It affects me by the changes in the seasons. I'm depressed because I can't get outside and move. I do start to gain weight. I'm living life one step behind. SAD is not fun for anybody. The word says it, you know, like it's an acronym, but still, it's SAD. It affects me by the changes in the season. So what happens is I get depressed when winter comes. It physically is too cold for me to go outside. And so I stop exercising and I have no problem exercising normally. When I'm immobilized and I can't move anymore, I am in my bed. I'm trying to do some work. I'm trying to stay focused, so I'm trying to write, but then I'm depressed because I can't get outside and move, and so I do start to gain weight.
So this is where I work. This is my desk if I'm not under my electric blanket upstairs in my bedroom. And I work here because the sunlight shines through those trees. It goes into the clearing and shines right on me. When that doesn't happen, like today on an overcast day, I just put on my sun lamp and there you go. I would have to look into that while I work.
My mood, if you could think of someone who has like they're PMSing, so their cycle is on and they just feel really anxious and they don't know why, but after the fact, they're gonna say, oh my goodness, like I'm sorry that I behaved so badly or overreacted. This would be similar to that. I wanna ask Dr. Zach about prescribing geography for people who suffer from SAD. Going away where the sun is, since my disorder, SAD, is brought about by the lack of sunlight.
now it's time to ask Dr. Zach.
And welcome, Gay.
Hi, thank you for having me.
Well, thank you very much for being here. So one of the ways that they determine that something is seasonal affective disorder is that it does vary with the seasons. Yes. And especially it's more common definitely in the northern latitudes. What have you found that's helped you over the years?
This last January, I went away to Nassau, Cat Island, which is in Bahamas. Nice. And I stayed there for 1 month and I didn't stop exercising. I lost weight. And I wasn't trying to.
Right.
So it was something that I said, yeah, no, this is what I need. I need doctors to prescribe geography for people who suffer from SAD.
Yeah,
so
absolutely.
I'm trying.
like many mental health issues, there's a whole continuum, you know. So we all feel down. Sometimes we all feel anxious, and oftentimes people feel a little bit down in the winter, and we tend to eat more kind of rich foods, that sort of thing. Have you seen a doctor about it?
I have.
Okay.
I was prescribed with Adderall. So I was trying to give something to my mind, my brain, to say, you know what, focus on anything but the fact that you're not feeling well about the weather, you can't move. Just forget that and focus on writing. So it's something that I can do naturally. I do it daily. And so I said, okay, let's do that.
Is that just when you need it, or use it regularly?
I was using it regularly, then I stopped completely to go to cognitive behavioral therapy.
Oh, has that been helpful to you?
I have yet to start it, so I will be starting because it is non-invasive.
Right.
If anyone could show me how to not feel down, depressed, bad about being who I am in winter, more power to you.
Absolutely. And definitely the specialists in this, psychologists and psychiatrists, they have strategies you can use to kind of change your way of thinking. So if you start the negative thinking, they have strategies where you can kind of reroute your thoughts to a more positive place.
Yeah.
Now, the other type of treatment I'm sure you've heard about is the light therapy. And it needs to have at least 10,000 lux. That's the measurement of the brightness of the light. So you're not getting enough light to your retina. The retina, by the way, is the part right at the back of the eye. We can show it. I can show it on the model as well. But basically, the light comes in through the front, and it's sensed on the retina, and that actually affects your brain function. So on this one, it would be here, this part of the eye, right at the back. And that actually affects your brain function. So what they found is, treating with these lights, it needs at least 10,000 lux, which is about 100 times brighter than your regular room lighting.
Yes.
But by the way, sunlight, like a bright sunny day, is about 50,000 lux, so it's still less than that. It's important not to get it with UV light because you don't want to increase your risk for skin cancer.
Yes.
And usually what they recommend is about 30 minutes a day in the morning. You don't have to be staring directly at it, but you have to have the light entering your eyes. Yeah. People, you know, with SAD, one of the things that's recommended is that they still try and get out during the day when there is sunlight.
Yes.
But obviously you have to be able to stay warm. Actually, you mentioned something that is a vicious cycle that people can fall into, and that is the weather gets cold, it gets darker outside, you don't feel like exercising. Mm-hmm. Exercise is another thing that's quite helpful in terms of staving off depression, but you don't feel like exercising anymore. And it's harder for everyone, but if you're not able to get warm, then that makes it even harder to get out there during the short daylight hours in the middle of the winter.
Yes.
So it's nice that you're attacking it from several different ways, and I'm pretty optimistic that you're going to have a good winter.
Yes, I hope so.
Absolutely.
I hope so.
Do you have any further questions?
Well, just that to get the word out, to give an option to people to have geography as a cure for SAD.
Yeah, so do what you can do.
Yes.
And also if you need to get south, you know, get south, but you have to find a way also to maintain that good mental health while you're still in these northern latitudes.
I know.
So thank you so much for joining us.
Now, Dr. Zach's prognosis.
So Gay suffers from seasonal affective disorder, which is a form of depression that is related to not getting enough sunlight. Now, in our northern latitude, that is a risk. So what I recommend for Gay are the following things. She needs to get outside, even in the winter. So if it means dressing really warmly and staying active. Those things will help her, absolutely. She can try the light therapy. That can definitely help. And she's starting the cognitive behavioral therapy. That'll help her as well. Now, in some people, Gay doesn't want this, but in some people, medications are necessary and very helpful. It's just in case that will help her. But I think with the other things I mentioned, especially getting outside, getting fresh air and light, that will help her the most.
Don't get your blood pressure up. We'll be right back.
Doctor's orders, don't waste your money on supplements. Usually they're a waste of money. Now you go to your doctor, you're feeling kind of weak, you're feeling kind of blah, you'll get a checkup, you'll get blood tests, and they will reveal if you're lacking any nutrients. If you are, you'll need supplements. However, if you're not, the supplements will only help your psyche. There's a powerful placebo effect, sure, but they're not really helping you, so save your money if you don't need them. Time for some questions. First question, please.
Yes, thank you. My name is Mary Lou, and I work in the security field. I have a two-part question regarding Alzheimer's. My grandmother, my mother, and my mother's sisters have all had Alzheimer's. I'm just wondering, is there anything that I can do to prevent myself from developing this disease in the future? And also, are there any tests that the doctor would be able to afford me to detect early signs of it?
Yeah, great question. And number one, is there anything you can do? There's no medication right now. However, there is evidence that you can do some things to prevent it or delay it at least. And even once people have it, to delay the progression. And the main things are activity. So I'm talking about staying mentally active, very important. Physical activity, also important. Also being socially involved. There's some evidence also that a good, balanced, healthy diet and good quality sleep actually is helpful as well. As to whether there's a test, and there isn't right now. The best we can do is making sure to stay active physically, mentally, socially, and have a healthy lifestyle. That does help for sure.
Thank you so much.
Thanks. Anyone else have any questions?
Yes, my name is Diane. I used to be a receptionist prior to retiring. My one question for you is, 5 years ago I had a tympanic plasty done on my left ear, and a year later it blew out again, and now I need to have it repaired. What are my chances of that happening again, that once it's repaired that it goes out again?
I happen to have an ear next to me.
Oh.
There's a tympanic membrane that separates the ear canal from the middle ear. Some frequent causes of perforation are, especially in kids, are recurrent infections, because it just the infection on the inside just irritates and irritates and irritates. It gets harder and harder, and then it can perforate. To be honest, most of the time it doesn't recur. The good news is most likely it won't happen again. Like most likely this is the last time you'll have to go for that.
Okay.
The risk factors potentially for a recurrence would be if you get recurrent sinus infections or ear infections, or you have a lot of allergies. It's important to treat those. Treat them pretty early on and aggressively, because the more those things persist, the more irritating it is to the tympanic membrane, and the more there's a risk for rupture.
Okay, thank you very much.
Thank you. And thank you for watching. We're out of time. And remember to catch us again on Ask Dr. Zach.